So, today we're going to be talking about some frequently asked questions that people ask whenever they search EMDR online. And I thought it'd be really good for me as an EMDR trained therapist to just answer some of those questions.
Awesome. Great. Take us through.
So, the first one that we have is, who is EMDR good for?
Who is EMDR good for?
Yeah. My answer to that would be that EMDR is good for basically anyone. It's good for almost anyone. Mainly who it's good for and why it can be good for so many people is it's really good for those who really struggle with some of those like blocking beliefs that they have about themselves. Some examples would be, I feel unworthy, or I am unworthy because of some trauma or traumatic memories in my past, or I deserve bad things, or, maybe you're even struggling with chronic guilt as a result of some of your memories in your childhood or later on in life. And so it can be really good for sort of unlocking that and allowing you to have more of a neutral response to your memories so that you're not associating some of these really bad memories or bad things that happen to you with I am bad or I deserve this as a result of
Mm.
some of the things that have happened to me.
So it's good for people who have these kind of beliefs that are affecting them every single day. And EMDR understands that those beliefs are tied to certain memories that they've had.
Exactly.
And there's some kind of process that happens where they're going to be unearthing those and loosening their hold in some way. Is that right? Yeah.
Yeah, I like to say that EMDR doesn't make you forget your memories. It doesn't get rid of them, but it does change your relationship to them.
Mm.
So it helps you sort of relate to them in a new way so that you aren't relating to them from this problematic, chronic, sort of stressful way that you just like can't stop thinking about them, and then it affects your personal life and relationships outside of it. It allows you to have a different relationship to them. Yeah.
That's great. Okay, what do we got next?
Yeah, a lot of people have asked, can it help with PTSD? It absolutely can. I think it's probably one of the most effective treatments for PTSD because it is trauma focused, but it also it helps kind of neutralize some of those feelings of terror and panic. Again, it doesn't get rid of some of our bad feelings about our memories. I've experienced EMDR before. I've experienced it as a client, and I still have some like bad feelings or
Mhm.
uncomfortable feelings about some of my memories, but it does neutralize some of the like terror and panic. I no
Mm.
longer get panicked whenever I think of some of the memories. And that's what I think it helps most clients do, is it can help very quickly and very effectively neutralize some of those panic responses so that you can actually talk about them more.
Mm.
Otherwise, you're just reliving the memories
Mm.
and you're just recreating this narrative of I'll never heal, I'll never get help,
Mm.
I can't be fixed.
That's great. So it's really perfect for something like PTSD, where these spikes of
Mhm.
panic, let's say, that a person experiences, or nightmares or flashbacks to a certain troubling memory. I'm going to ask a question for people listening there of, how do we know that it helps? Are there studies that have been done on PTSD, people coming in for EMDR,
Mhm.
or what has that been like?
Yeah, some people can have a lot of like trepidation with EMDR. Is it research based? That's
Mhm.
another frequently asked question. Is it an evidence based practice? And I can say that it has been for over 33 years. So there has been a lot of research out about the effectiveness of EMDR, especially with stress levels. So a lot of the research with EMDR is, how stressed were you about the memory before you came
Hmm.
into EMDR? How stressed are you now?
Wow.
So a lot of those studies have shown really effective decrease in stress levels over time
So
associated with the memories.
right. So they come in reporting a certain level of stress about
Hmm.
their memory, and then they measure them after it, and the people are reporting in a significant way that there's a reduction in the ways that you're talking about. That's really good to know, I think. And the reason I was asking is because my understanding too is that PTSD is like one of the most researched kind of
Yeah.
diagnoses
Hmm.
that have been treated by EMDR. I think it's a really powerful thing. Yeah. So for 33 years, I wasn't aware of that.
Yeah,
Yeah.
33 years. Since 1989,
Hmm.
it's been researched. One of the things that is so I think helpful from EMDR, and one of the things that's so problematic about PTSD and what can be so hard for clients who have PTSD, is a lot of those symptoms are you experiencing past events as if they were right in front of you.
Mm.
Those flashbacks, those nightmares, whatever problematic things are coming up for you, your brain, whether you know it or not, or whether you realize it or not, your brain is experiencing it as if you were there in those memories. And a lot of the problems that people have with PTSD is getting back into their body after experiencing something that traumatic, that you literally either left your body in that experience or it just takes over your body. So PTSD, your brain is literally lit up like you are experiencing a past event in the present.
Wow.
One of the things that EMDR helps us do is go back to those past events while keeping us in the present. And the bilateral stimulation, which is the actual physical act of going back and forth on both sides of your brain, that actually allows you to stay present while you're reliving, or not reliving, while you're reprocessing some of the past. So there's a difference between reliving it and reprocessing it.
This idea of keeping one foot in the safe therapeutic environment and then the other foot in the scary situation, so that the scary situation can kind of heal and not feel so scary. That makes a lot of sense.
Exactly.
Yeah.
Then you can integrate it. You can kind of you can have some of the painful memories of your past. You can have your present, and you can integrate that to say, I had some bad things happen to me. I am not bad as a result of it, and I can be safe. I wasn't safe here, but I can be safe. Not I'm safe all the time, because we can't promise to be safe all the time. There will be more difficult memories, but you can be safe. You can integrate that.
I like that.
Yeah. That kind of brings me to this next question, which who is it not good for? It's good for a lot of people. I would say people who should be wary, or who should steer clear maybe from EMDR, is first off, if you have schizophrenia or any sort of psychosis. If you've had any of that in the past, it's probably best to steer clear from EMDR. Mainly because it is a lot of a self-guided process. And so if you have any reactions to like some internal stimuli in your brain that is not actually there, that can be pretty troubling and stressful. So it's wise to maybe steer clear of EMDR if you have that. I think it's also wise to steer clear if you have a dissociative disorder. So very different from somebody who dissociates. A lot of us dissociate as a result from trauma. A lot of us dissociate whenever we're driving because we are just so used to the patterns.
Right.
But somebody who has a dissociative disorder and is constantly dissociating within their day might need a more specialized treatment. And there are actually EMDR therapists who do specialize in dissociative disorder. So it is still for you, but you should really look into some more specialized care. And there are therapists who do specialize in that.
So if that's you just need to know to say something as you're getting involved that you have some kind of diagnosis or suspicion that you have some kind of diagnosis like this.
Exactly.
Yeah.
The last thing that I'll say is be particularly wary if you just experienced a traumatic event. If you are just coming from, some sort of assault or some sort of, within a week or within a few days, we're not going to be able to reprocess that. What we can do is desensitize. So EMDR, eye movement, desensitization, and reprocessing. For some clients, we're not going to get to that reprocessing phase. Reprocessing is really the ability to look back on that memory and actually have some sort of new insight from it, to be able to install some new beliefs about yourself, or to have some different relationships to your memory. Yeah. The desensitization is really it's where you can kind of come down on your stress levels from it. And so that can work for recent events, but we're not going to be doing the reprocessing piece of EMDR. So make sure you notify your therapist if you've had something very recently occur, because you don't want to go into the reprocessing phase if you're just experiencing something.
I can see that.
Yeah. Somebody else asked, which issue do you focus on first with EMDR? So the first issue that you focus on, the first issue that I like to focus on, there are a lot of different EMDR therapists that do it a different way. this is how I was trained to do it, was to focus on the first memory that you have. That can be a disturbing memory or it can't. But a lot of that is really just getting you into the process of EMDR.
So whether or not it's a negative or difficult memory for you, just going back and starting with what's your first memory is a nice way to kind of put your feet into the water with something that's maybe a long time ago, but has been significant for some reason for you.
That's right. Yeah. Now, here's the thing about our brains. A lot of us attach our first memories as distressing memories. My first ever memory was falling off of my bike, not knowing where my dad was. He was right behind me, but like that's the distressing piece of it was, where's my dad? I just fell on my bike.
Yeah.
So that can be, just our brains hold on to the distressing memories. They do that to protect us. But when we get to adulthood, it no longer serves us to hold on to those memories as with the negative beliefs that we hold for ourselves because of it.
Right.
It no longer serves me to believe I am not worthy because I can't ride a bike or something like that.
Right.
I can ride a bike,
Yeah.
but those are it's essential to kind of get that process going for your brain to be able to start that work of reprocessing.
I see. So not only is it something that is maybe more accessible for some place to start, but also it can oftentimes hold a lot of meaning for them, or some of these beliefs that you're later going to be encountering with some other memories as well.
Yes. Yeah. I'm often so surprised what comes up with the first memory. You'd think that you'd come for your worst memory, but like there's a lot of work there in that first memory. So it's really neat what comes up.
Yeah.
Then you go on to your worst memory. So you start with your first, then you go on to your worst memory. And so I'll take my clients through the worst experience that they can remember. And it can be extremely distressing. It can be really uncomfortable at first. But what I found is with EMDR, that desensitization, it really helps just like you not feel as stressed as you bring up that memory. So going through that worst memory, it can be really uncomfortable at first, but then I found that, coming down from that, it builds a lot of trust in the brain to be able to say, oh, I just did a hard thing. I just went through one of my worst memories ever, and I came out the other side.
I was okay.
Yeah, I was okay. And that's why it's so important to have a trained or certified EMDR therapist, is because you're going to go through some uncomfortable things. EMDR is not comfortable. But what you can do at the end, and what a trained therapist can do, is to show you how to close up that chapter so that you're not leaving the session just completely derailed and reprocessing the event on your own.
Yeah.
So it's really important that you're reprocessing some of these memories with that trained professional, because they can get you, calm down so that you're not just like stuck in that processing mode.
Right. It's like if they're able to help you feel safe again, that's the difference between feeling re-traumatized by the memory and feeling safe and having that kind of reprocessing happen.
That's right.
Is their ability to feel very familiar with this process and not be overwhelmed themselves. It's not just talking about it, right? It's not just feeling it. It's this kind of process of that finding safety again that can make the difference there. Is that what you're saying?
Yeah, that's right. Yeah, that's exactly right. I think that's a key part to EMDR is coming back into the present and talking with somebody and saying, what are you experiencing now? What is this process for you like now? So, yeah. What is a session like? So what somebody asked, what does a EMDR session look like? Because it is different than talk therapy. It's not as back and forth with the therapist. It is a lot of, you are kind of the captain of the ship of your own processing in a sense. You're walking with a therapist. They're checking in with you, but a lot of what's going on is kind of what's happening for you internally as you're doing bilateral stimulation. And I use tappers. So I have these things that buzz on each hand, and what that does is that activates the memory, and that allows you to really go into the bilateral processing, which is kind of an essential piece of EMDR. But first, what we'll do is we'll target the memory. So take, for instance, your worst memory. What we're going to do is we're going to target that. And we're going to have you share what happened, or just share pieces of the target memory that are really distressing. Then I'm going to ask, what image do you think of? What is the most distressing image that you can think of when you think of that memory? Then I'll ask, like, what's the negative belief that you have behind that memory? Because that's a key piece to EMDR. We're wanting to unlock that negative belief that you hold about yourself because of the memory, because that often is what contributes to a lot of our problems at present, what we're facing and the difficulties we face at present. Then I'll ask what emotions come up, and then we'll talk about sensations. So body sensations, as you're talking about this memory, as you're thinking about this memory, what body sensations are coming up? Because it's another key component to EMDR that's so essential is it's a somatic therapy. So we're really trying to get you back and connected with your body sensations, especially for those who feel disconnected from their body as a result from the trauma. Then we'll reprocess. We'll do desensitization with bilateral stimulation, and then I'll be guiding you through that reprocessing phase, which is to keep going into the memory, develop new insights, go back into the memory, develop new insights, go back into the memory. So you're constant, and our brains have this trail of thought that it can go down that really can get us to the root of the memory that we're processing, because the root of the memory is often associated with that negative belief that we hold for ourselves. And then everything else is kind of like the branches of a tree, where we have multiple memories that kind of connect us to the root belief, which is I deserve this, or I'm not good enough, or
which, I mean, literally you're talking about the neurology there. When you're talking about the branches, you're talking about dendritic, patterns that are all held around this one, let's say, like, like a knot in the muscle is what I'm thinking of when you say that. Like there's this knot and you can feel all your nerves. And as you get closer to the knot, it's like your brain kind of goes like, that's where you need to push.
There it is.
And then there's a pushing down and an understanding, acknowledgement, something relaxes there. The question I had for, I guess, people unfamiliar with EMDR is, okay, so you're talking about you get into the negative feeling or the memory, and then you do this thing where you pause and you do this bilateral stimulation. What is that experience like in that moment? If you're sitting in that chair doing that, what should that feel like in that moment?
Yeah, one of the things that it does trigger is eye movement. It's eye movement desensitization. What bilateral stimulation does, especially with tappers, or even when therapists are doing the follow the eye tracking. There are some therapists who are specifically trained in that. I do tappers, but what it triggers is eye movement that mimics rapid eye movement that occurs in sleep or dreams. And that's at least a theory that it's believed to unlock some of the memories, because like what's held in our subconscious is often what can provide some unlocking for our consciousness, what can kind of bring us some healing as a result of what we've stored deep in our subconscious.
So what does that feel like usually? Like you said, you've done it. I'm sure you've witnessed clients, patients doing this. What is that usually like for them to do that part of it?
Yeah. What I was going to say is the eye movement is kind of odd at first. It's, it's like there's literally like a rocking sensation or kind of just a back and forth that happens in your eyes that you're like, whoa, this is kind of weird. And the buzzing can kind of, what it does is kind of light up your brain. So you can actually feel some of your it's almost like a rush maybe in your brain as you're experiencing some of these memories. But then as you go, there's almost like a calming effect, like a cooling down that occurs. Because what the goal of EMDR to get you somewhere first is to almost like light up the memory, get it really hot and just big. And so you're going to feel that, and the tapping kind of just makes it like, whoa, there it is right in front of me. And then you'll just feel almost like your brain just kind of, it's hard to describe.
Cooling down.
Your brain just starts to like almost cool down.
I'm thinking about a similar sensation. You can do this thing where, and for people listening, you can do this as well, of when you clench your fists, like, and you clench them as tight as you can, and then you just let them go. There's it's not just nothing anymore. There's like
Yeah.
kind of an exhale kind of feeling. I don't know if that's exactly the same, but I'm picturing all these physiological processes that mimic this same kind of pattern, right? Of this high tension that's intentional.
Yeah.
And then there's something that's released, something that cools down.
Right.
Right.
Yeah.
Okay.
I think that's exactly how it is. It's like the blood rushing back into your brain almost.
Yeah.
Because one of the things that happens, or that happened for me whenever I experienced EMDR, is like my breathing changed. So it got a little bit more rapid. I was thinking about, something really distressing. So I was experiencing the distress almost like I was in it. But then the tapping always just brings you back to like, no, you're here.
Yeah.
And that sort of rush and that sort of brain rush, I think is kind of what occurs is like your body is learning how to relax while recalling some of these events.
Yeah. That's wonderful.
Yeah.
Yeah.
Yeah. And it's really neat because our brains know what to do. Our brains know where to take us. Our brain actually wants to get some of these memories unstuck. What our brain also does though is prevent us from feeling discomfort. And so EMDR is a lot of how can we get you uncomfortable, but then also come out the other side.
Yeah.
And start to feel some of the relief of that. It's very similar to going for a run. You're not going to like it at first, but afterwards you're going to feel some of the benefits of it.
Right.
So,
right.
Yeah. Is EMDR like brain spotting / hypnosis? So both, people have asked for both of these things. Is it, and I kind of want to talk about both. So brain spotting is very similar to EMDR in that, there is, some eye movement going on, but what is different about brain spotting, it is a somatic therapy similar to EMDR. But what you do is brain spotting is a little bit, it's less structured. So EMDR has 8 phases. And we talked about what a session looks like for EMDR. For brain spotting, it can be a lot more fluid. It's a lot more just like locating. The belief in brain spotting is that there are different spots in your brain that get activated based on the places that your eyes go. So there might be like a traumatic or emotional experience like right here in your eyes as you move like that. And eye movement desensitization is more structured, but it's also just more systematized. So you're just doing this as opposed to looking for certain traumatic memories that are located in different spots in your brain. And hypnosis, it is very different from hypnosis. I've heard a few people say like, oh, I hear it's like hypnosis, or is it like hypnosis? And some of it, some of the tone that I hear is trepidation or fear around hypnosis, because I think maybe the belief of hypnosis is that you might be out of control.
Yeah.
Or you might be entering into a consciousness that's uncomfortable. And what I would say to that is, hypnosis is you're actually entering into a different consciousness, and you're looking for some suggestibility in your brain, the ability to do things and not have as much hesitations or have sort of those like super ego talks, somebody telling you shouldn't do that. So that's very different from EMDR. And I think EMDR, one of the things that I try to remind people if they are curious or even cautious about it being like hypnosis is you are in full control the whole time, which is true of hypnosis as well. That's also a belief that needs to be clear about hypnosis. You are actually in control of your body and what you're doing. EMDR, you do not change consciousness. You don't go anywhere other than where you are at present. It's actually a very present, therapy modality. You are actually so present as you are focusing on some of these memories in the past.
Right. So what I hear there is that EMDR is the strength of it is that it is much more structured in much more explicit ways than these other ones, even though I'm sure they have their own structure about how they orient themselves or what they're paying attention to. Yeah. EMDR is a very like delineated structure of like, you're going to do this, then you're going to do this, then you're going to do this.
Right.
And I think that's just helpful for trauma in the sense that anytime there's more chaos, we need more structure to feel safe sometimes. Like we need to know, okay, I'm going to do this, then I'm going to do this. That's like, I think that's something kind of natural to us, is that the more overwhelmed we are, the more we're looking for structure. Right. And I hear that as being one of the strengths that EMDR has, is that when somebody is traumatized and they feel afraid about coming close to the emotion, you can lay out these 8 steps. And if they were to ask, you could show them exactly where they are on the path, and where they're going. Right. And I think that can be a really safe feeling for people, is to kind of know where they are on this path that many people have walked before.
Yes. Yeah, I think that's exactly right. And I think there are, one of the things that I love about this therapy field is there are so many things that can be helpful to you. There are so many techniques, and I think brain spotting is a great technique. I think hypnosis is also a great I don't know much about it, but I think these are all techniques that we can use. And I think EMDR, especially for somebody who needs that structure or is in need of just like a guided process that is like very clear. This is where we're going to go. This is how far I'm going to take you, you know, like I think it can be very comforting, especially in times of experiencing a lot of chaos in your life, to be told, hey, this is what this is going to look like. And I like that we can stick to that sort of structure in the process. So
great. Awesome. John Allan, thank you.
Yeah.
Yeah.
Thank you.